Thank you. Mr. Ndip.
Thank you, Mr. Chairman. My name is Frederick Ndip, and I work for Planned Parenthood as a Community Initiatives Manager. I'm here to testify for the need for comprehensive family life and health-appropriate sexuality education for all children and adolescents, but more especially to the many thousands of children from immigrant and ethnic communities who face unique challenges when it comes to sexuality. There are multiple reasons why all children and their families should have access to comprehensive sexuality education. So I'm not going to dwell on those reasons here. I'll rather speak to the unique challenges that immigrant youths face growing up in a multicultural environment and the sometimes conflicting cultural beliefs and attitudes about sexuality that need to be addressed. I'll start by letting you know what sexuality education is to young people. Sexuality education is about safety. It is about knowledge, awareness, decision-making. It is about choice, responsibility, and dignity. Sex education aims to reduce the risk of potentially negative outcomes from sexual behavior, such as unwanted and unplanned pregnancy, and infections with sexually transmitted diseases, including HIV. It also aims to contribute to young people's positive experiences of their sexuality by enhancing the quality of their relationships and their ability to make informed decisions over time. This experience should be available to all children, including children from immigrant families. Sex education is about more than just keeping our kids from having kids before they are ready or getting STDs. It is also about making sure that they understand the emotional, psychological pitfalls of sex and how this can affect them. One of the ever visible signs of lack of comprehensive sexual education to teenagers is pregnancy or teenage pregnancy. Over the past few years, the Minnesota Department of Health reports a spike in teenage pregnancy rates over the Richfield, Broken Park, Broken Center areas. It is no secret that these areas are heavily populated by Latinos and African immigrants, respectively. While there is no specific data as to the race or ethnicity associated to these rates, it leaves little doubt in my mind that the immigrant teenagers constitute a substantial number in these statistics based on the fact that the area is overwhelmingly populated by immigrants. Statistics about teenage pregnancy and STI, HIV rates are a good indicator. However, statistics do not tell the whole story. Sometimes listening to personal stories of teenagers and other members of the community we work with provide vivid examples of the lack of comprehensive sexual education to our young people. A few months ago, I received a voice message in my office that was left on a Sunday at about 10 p.m. at night. It was from a girl, an African immigrant girl. She stated that she was 14 years old and her parents are from Liberia, and that she is 3 months pregnant and she doesn't know what to do. She got my business card from one of the past participants of our youth peer education program that we have in the community. And she wanted me to help break the news to her parents because she was too scared to do that. Of course, her parents were very upset when I told them about the pregnancy. They readily admitted that they had never had any discussions about sexuality with their daughter. She too stated that the only sex education she ever had was in a biology class. Her story is not an isolated one. There are many teenagers out there whose only lesson about sexuality or sexual education has been in a biology class. Many children of immigrants live in dual cultural settings. In their families, they are raised in the values, beliefs, attitudes, and practices of their native countries. Many of these belief systems view any discussion about sexuality in the family as taboos. In my culture, for example, conversations about sexuality between parents are done out of the reach of children or when children are not around. Questions about sexuality by children are regarded as signs of disrespect. In most cases, these children would find a way of getting information about sexuality. It is unfortunate that a kid is not able to ask his or her parents questions regarding sexuality. Traditional and cultural practices are slow to adapt to changes in reality. But when tradition tends to ignore the needs of our children, the only reliable option is our school system, especially to immigrant children who in some instances spend more time in school than with their parents who work longer hours to make ends meet. So while we debate about the merits and demerits of comprehensive sexual education to our young people, let us know that there are a lot of young girls getting pregnant and many others getting or contracting STIs because of lack of sexual education. Thank you for the opportunity to speak to you.